I'm honored to be joined by a leader who understands the importance of both vaccinations and primary health care, Indonesian Minister of Health, Budi Gunadi Sadikin. Oh, over here, yeah. Minister Budi is something of an unlikely public health hero, but he's a hero nonetheless. He was actually working as a finance minister when COVID-19 hit, and the prime minister tapped him to serve as the minister of health. Mr. Budi, can I ask you a question?
Yes, Ati.
I know you're a father. I also had a new child about 30 seconds ago. How has being a dad shaped how you see your job?
As a dad, I would like to see my 3 kids never got sick, stay healthy, and pray for me. But as a Minister of Health, I would like to see 280 million Indonesian people never got sick, stay healthy, and pray for me, and my wife is sitting there.
Great.
Watching you.
Okay, great. Well, thank you. Minister, take it away.
In 1964, the year I was born, 1 in 7 Indonesian babies never made it to their first birthday. Thanks to childhood vaccines like smallpox that I received, I was fortunate to survive, grow up, study physics in university, build a 30-year career in banking, and eventually become the Indonesia Minister of Health. In 2020, at the height of the COVID-19 pandemic, I never imagined that the President would appoint me as the Indonesia first Minister of Health without a medical background. He gave me 2 tasks. First is to roll out COVID-19 vaccine as quickly as possible, and second, to carry out the largest reform in our health system history. In the less than 2 years, we delivered around 450 million doses of COVID-19 vaccines, protecting 280 million Indonesians. When the pandemic subsided in 2022, I turned to the second task. I realized that my responsibility was not only to steer us through the crisis, but to build a national health system strong enough to protect every child, every family, every citizen long after the crisis ended. Every year, thousands of Indonesian mothers and children die from cervical cancer, pneumonia, and diarrhea. That is why, right after the pandemic, in 2022, we added HPV, PCV, and rotavirus to our national immunization programs. As health minister, I visited around 30 remote islands of Indonesia. We have 7,000 inhabited islands. And I've seen how childbirth often means life or death. Without access to ultrasound, many mothers are unaware of their pregnancy. Complications go undetected. Referrals are delayed, and lives are lost. We only have 2,200 ultrasound at 10,000 primary healthcare units that deliver 4.8 million babies every year. You know, I need to train the doctors and distribute this ultrasound in 2 years. I also noticed that people with chronic diseases such as kidney, stroke, heart disease, and cancer reach the hospital when the condition is at the late stage, when treatment is limited and costly. Hence, in February 2025 this year, we launched our most ambitious primary healthcare program ever, the annual free health screening for 280 million Indonesians. Our dream is to detect these conditions early and begin treatment promptly. To date, it reached already more than 30 million people, and we aim to reach 50 million by the end of this year. That is why investing in primary healthcare is so critical. Not only does it cost less, but it also gives people a better chance at longer quality lives. I cannot let 20,000 babies die every year, nor I cannot let 90,000 Indonesian children die every year. Indonesia believes that health system, both national and global, cannot be secured by one hand alone, but a chorus of hands join together to lift the sick, the weary, and the forgotten. It is the weaving of many strengths into one fabric of compassion, where nations do not compete for victory, but cooperate for dignity, not to conquer each other, but to conquer diseases, not to claim glory, but to safeguard life. 61 years ago, I survived while millions of other babies did not. Today, infant mortality in Indonesia has fallen by almost 90%. Thank you. But I will assure you that almost is never enough. Let us ensure that survival is no longer left to chance, but a promise that every child deserves a healthy start, a strong foundation, and a chance to thrive. Thank you.